12:23, and now time to answer some common health questions. And joining us now is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you so much for joining us.
You're welcome. Good to see you. All right.
So we can see you here.
Yeah.
All right, we're going to start with our first question. What is best to place on a minor burn, butter or ice?
Yeah, you know, this is actually a common question, and it's really a home remedies gone bad, because the answer to that is neither. You don't want to use either. What you want to do is you want to take the burn, put it under cool water, and let it run over it for about 15 to 20 minutes. What that does is it cools it and it cleans it. Ice actually can freeze the tissue surrounding the wound, actually impairs healing. Do not want to do that. And anything like butter, grease, or toothpaste can actually also impair healing, worsen tissue damage, and then it also can cause infection. So after the cooling, all you want to do is on minor burn, aloe vera. If it has blisters, you can add Neosporin, or we have a prescription strength topical ointment called Silvadene, but that's all you need to do. And also, if there are blisters, don't break them open. Leave them closed, because that acts as a biologic dressing. If you open them up, it causes more pain and can worsen infection, so leave it alone.
I might have to send my mom an email. She put butter on my burns.
Well, you know what? You got lucky.
Thank you. All right, let's go into our next question. For a small cut, should you put on a Band-Aid, or is it best to give it some air and let it heal?
Yeah, you know, this is a great question, because I don't think a lot of people really know the answer. So I kind of wanted you to picture something here. With regular skin, obviously, it is covered by your epidermis. The skin deeper to the epidermis is moist. It's got blood flow, it's got oxygen. When you have an open wound, it's open to air, it dries up. So it takes it out of its natural environment. That dryness can impair healing. Now, you add on top of that, once it gets dry, a scab. The way a wound heals is from the bottom up, and it pulls the edges together. What does a scab do? It impairs the skin's ability to do that. So it actually delays healing and can actually cause a worsened scar. So you really don't want to do that. A bandage, though, acts as temporary skin, protects it, keeps it moist, and can also prevent contamination, which can lead to infection. So bandage it up.
Okay, I tell you every time, it's much smarter when you come. Well, thank you so much, Dr. Soria. And if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com, and clicking on the health link. Then scroll down, and on the right-hand side, you'll see a form to write in your question. And I am going to get on emailing my mom about that butter.
You let her know.
All right, thank you so much for coming in, Dr. Soria, and we'll see you next week. We're right back.